Ostomy paste, which comes in many different preparations, paste, strips, etc., these can go a long way when trying to seal a wound in difficult anatomical locations. When using any of these preparations, make sure they are warmed up by holding them in your hands. This will also aid in the application. Paste may be placed in any crevices or skin folds that may inhibit a good seal. For example, with a sacral or coccyx wound, you may need to place a small amount of paste in the gluteal cleft and then apply the transparent film over it. This will act like caulk to seal the crevice. You may place the paste on top of the transparent film. However, there is a risk the paste will stick to clothing or bedding, and placing it under the transparent film will prevent this. Ostomy paste may also be used around pin sites. Dress the wound as you normally would, and then turn on the negative pressure wound therapy. Once the suction is applied, place a small piece of paste around each pin until the seal is tight.